Good afternoon and welcome to Season 3, Episode 2 of the live career HOP webinars. The purpose of these webinars is to give you, students of Hertfordshire and surrounding areas, the opportunity to hear directly from people who are performing a profession that you are interested in. So the theme of today's session is careers in physiotherapy, and we will have for you two fantastic panelists who will be able to share their experiences with you. So really what we want you to get out of the next hour or so of this session is to find out a little bit more about what a physiotherapist actually does. We're going to talk about the sorts of skills and qualities that they need, as well as the qualifications. So we may be able to give you some really good advice today on the sorts of A-level choices that you might need to make, degree courses that you might need to make as well. We'll also drill it into a little bit more detail about what's enjoyable about the job, what's perhaps challenging about the job, and things that you may not be aware of yet. So that is the purpose of the next hour or so. Just to give you a little bit of housekeeping, just to reassure you, we can't see or hear any of you that are watching this session live at the moment. I do know there's about 20 of you at this point watching live. You will be able to hopefully see and hear us. So our second panelist, Janice, will be with us very shortly as well. As we have the initial conversation with them, though, you'll have the opportunity to put your own questions to them and to ask any questions that you would like to ask. And the way that you do that is on the dashboard in front of you, you'll see that there's a questions tab. So if you click on the questions tab, that will open out, and then you can type in your question in there. Those questions will only be visible to me as the presenter, and then I will forward those on to either Peter or to Jenny. So do get those questions in. So it's a really good chance for you. Any questions, anything that you want to know, this is your chance to do that. This video is being recorded, so if you're not able to stay with us throughout the whole session, you will be able to watch the whole thing back again through our HOP platform. All those videos will be on YouTube as of tomorrow. So what I'm going to do now is I'm going to hand you over to our first panelist, Peter Ross, who can tell you a little bit more about his background and his role at the moment. So Janice will be joining us very shortly as well, and she'll do exactly the same when she comes on. And then we're going to crack on with some questions. So Peter, very good afternoon. Thank you for joining us today. Tell us a little bit more about you.
Afternoon, Gareth, and thank you for having us today to talk to your guests. As Gareth said, my name is Peter Ross. I'm currently working at the University of Hertfordshire, as you can probably see from my background. I'm currently working as a senior lecturer in physiotherapy, and I've been doing that for the last 12 years. And on top of being one of the senior lecturers, I'm also the admissions tutor. So I'm the person that looks at all the personal statements and the applications and decide who comes on the programme and who doesn't. So from that perspective, I have quite a kind of unique kind of angle in terms of what you could be thinking about doing to enter a physiotherapy degree. Prior to my time at the University of Hertfordshire, I've had quite a long kind of career previously working in various different guises, primarily working in the NHS, but also working in private practices, both in the UK and overseas. I spent about a year and a half, 2 years working in New Zealand in the public health sector, and also working in private practices there. So my experiences are quite varied. I've worked in lots of different specialisms over my time, from paediatrics, working with children, through to elderly care, working with amputees, working with people that have burns and have plastic surgery, to orthopedics, musculoskeletal outpatients and sports as well. So I've kind of covered most of the areas in physiotherapy, so hopefully I can answer a lot of your questions today, and if not, I'm sure Janice, my colleague who joins us shortly, will be able to kind of fill in some of the blanks if I can't do that for you. So that's pretty much me in terms of who I am and where I've been and what I've done, really.
Okay, thanks very much, Peter. And I'm sure there'll be lots of questions that people will be very interested to know about you, particularly as people are starting to think about UCAS applications as well. So look, the first area that we're going to touch on, so there's a number of questions I'm going to go through first of all. I know when you all registered to attend this session, some of you did put down some questions or things that you wanted to know. So I think we're going to try and cover those in the first section, and then I'm going to hand over to you. But please do start getting your questions in now, so we can ensure that we can get them to Peter. So first thing I really want to find out is, it sounds an obvious question, but what is a physiotherapist? So tell us, Peter, what is a day in the life of a physiotherapist?
Okay, so a physiotherapist obviously is a healthcare professional. We are often now seen as first contact practitioners. So that means that often clients, patients will come directly to us with their problems and their issues, And as physiotherapists, it's our job to assess and diagnose what's wrong with them, what we can do to try and help them to kind of enable them to recover from whatever kind of issue they may have, be that an injury, be that a long-term illness, be that a disability. Previously, kind of physiotherapists were often a second contact practitioner, whereby clients and patients would go to see their GP or a consultant and then get referred on to us. And very often now, that still happens, of course, but often there are direct access routes into physiotherapy. So we're very much responsible for that first contact and for trying to understand and diagnose what's going on with the patient, and then put an action plan in place in terms of how we can help them overcome their problems. And that can often be relating to kind of hands-on manual therapy, so manipulating and mobilizing various parts of the body, the joints, the muscles, the tissues, the nervous system. And it can also be obviously things like exercise and advice. We may use modalities such as electrotherapy, machines to help out, may use things like cryotherapy, ice, hydrotherapy, as well as lots of education and trying to empower the patient to take on board elements of their own healthcare. And in addition to that, we are also very much kind of working towards the aim of trying to kind of educate patients in terms of preventative healthcare as well, and long-term maintenance of their well-being. So it's quite a varied job that we do. And again, there are very many different facets or specialisms, as we call them, in terms of where you can work as a physiotherapist.
Sure,
So
we'll go on to explore those, but so it's a really good opportunity to bring Janice into the conversation, who's with us now. Janice, if you looks like you're just on mute, if you can take yourself off mute, if you can see where the microphone button is on your dashboard. We had the problem in the test run that we could hear Janice, but we couldn't see her. Now we've got the opposite problem, but this is new software for all of us, so just bear with us a little bit. In fact, Janice, well, you come off mute. Once you find that button, Janice, come off mute, and then we'll look forward to hearing a little bit more of an intro about you. Let me just put the next question to you, though, Peter. You just spoke about some of those, I guess, branches of physiotherapy that people could go down. Could you just go through in a bit more detail about the different areas of physiotherapy that someone might go into?
Yeah, for sure. As I kind of mentioned in my little bit of an introduction in terms of what I've done in my career so far, there are many, many different specialist areas that you can go into in terms of physiotherapy and kind of focus your attentions and your development. And again, they vary enormously, as I said before, right through the kind of age ranges from kind of pediatrics and working with children, working with neonates and the newly born babies, right through to end of life care when we're looking at the older person, as well as things like kind of looking at kind of the end of life care in terms of palliative care. So people that are drawing towards the end of their life in perhaps a non-natural way, if you like. So people like that are suffering from long-term diseases such as cancer, we can work with those patients as well. And again, there's lots of specialisms. The kind of big one that most people are familiar with is the musculoskeletal side of things, where we are working with joints and bones and muscles and tissues, and often that's relating to a specific injury. You may have twisted your ankle, you may have hurt your neck or your back, for example, and often that's kind of seen in an outpatient type of setting where you go to a hospital or a clinic and a physiotherapist will be working with you both with exercise and hands-on treatments to treat those tissues that have been damaged or injured. And that kind of goes hand in hand with some of those sports injuries, and a lot of people do perceive in the general public that physiotherapy is all about sports injuries. It is certainly a part of what we do, but it's actually quite a small part of what we do in terms of the range of experiences and kind of specialist areas that we can work in. So we work in things like the musculoskeletal, I said before. We work in the cardiorespiratory field, so treating patients with and clients with lung problems and cardiac problems, heart problems. So those patients with perhaps chronic obstructive pulmonary disease, a breathing disorder, cystic fibrosis, those patients with asthma, those patients with chest infections, as well as patients that have suffered heart attacks and those kind of things. So there's quite a different element there in terms of what we do that most people don't quite understand. And very often that type of treatment takes place in a hospital setting, and more often than not can be in quite an acute hospital setting. So we do lots of work in intensive care units for people that are ventilated using artificial machines to breathe with. And you may have seen some of that during the kind of COVID coverage in the news, where physiotherapists are key in helping to keep people's lungs clear from phlegm and secretions via various techniques, and try to improve the ventilation or the breathing and how much oxygen is getting in the body by positioning them in certain ways. So that's another kind of field of physiotherapy that we work in. Another kind of key one, and perhaps a core one, if you like, is neurology, which is to do with kind of the brain and the nervous side of things, the nervous tissue, the nervous system. So patients that might have had perhaps a brain injury, a traumatic head injury, or may have had a stroke perhaps, or suffer from Parkinson's disease. Those are kind of patients we might treat in terms of the neurological side of things. Or those patients that have injured their nerves in some way, perhaps have managed to dissect a nerve in an injury, perhaps affecting their arm or their limb, or perhaps have nervous system disorders that we can, again, help to treat and try to facilitate recovery and kind of independence and mobility again. So quite a few areas to work in. And again, there's the more specialist niche areas, if you like, things like amputee rehab that I was quite involved with when I was working clinically in vascular surgery. So working with people that have lost limbs or are born without limbs, and you can help to kind of rehabilitate them. You know, kind of working with pediatrics, young children through to teenagers as they become adults, working with various conditions they might experience. Working in fields like mental health, which is perhaps underappreciated in terms of what physiotherapist does. There's a really big impact or input from us in terms of helping people with mental health disorders and learning disabilities as well. So the kind of world is your oyster in terms of where you want to go in terms of specialising. And I say to a lot of people that apply to the physiotherapy course, you know, everywhere, every kind of walk of life you can think of, you'll find a physiotherapist somewhere behind the scenes. You know, think about occupational health. Think about setting up your workstations to prevent injury. Physiotherapists will be integral to that. You know, one of my students, when they qualified, went on to join a cruise liner. So he was a physiotherapist on a cruise liner. So, you know, everywhere you think about, physiotherapists can be found there. So there's lots of options to go into and explore and kind of pursue your area of interest in this career.
Yeah, no, it sounds like it. And you spoke about some of the niche areas of it, and this is a good point to bring Janice in now, who I know is nodding as you were saying that, which means that her audio connections, I think, is fine now. Janice, could you just give us a little introduction about you and your journey into physiotherapy, and tell us about the incredible things that you're doing now as well, and the things that you've set up over at Princess Alexandra Hospital?
Yeah, thank you very much, and I hope you can hear me better. So I started physiotherapy. I graduated in 2003, but this is way back home in the Philippines. So straight after university, I came to the UK to practice physiotherapy here. But at the same time, I got involved in a lot of as a clinical educator for students from University of Hertfordshire, and that's how I remember Peter, and different universities from London as well. And the closest one to us is the Essex University as well. And the journey started as a rotational physiotherapy. So once you graduated, so after Peter polished you into the nicest and the best potential physiotherapy from the academic side, then it is our turn in the practice to mold you into the real world. Although what I really like is having the placements with the students, because that's how we give you an insight of what is the real world. And while you are learning physiotherapy, you're actually given the opportunity to see it in practice, and at the same time to apply the skills that you have learned from uni to the clinical floor. And as Peter was saying earlier, it is a wide range of opportunities for physiotherapy, and you could go anywhere. I mean, in my rotation, I remember, so usually the rotation during my time was 3 months. I think now we have increased to 4 to 6 months to allow junior physios to be able to get that really feel and learn the skills or the basic skills that they could learn as much as possible in every single rotations. So I probably have done, I'm not gonna say half of those what Peter said, because MSK is something that is definitely not the one that I felt comfortable of working on, and that's the reason why I did respiratory. So working in the ICU, I did surgical, working with amputees. I did women's health, so working with newborn children, and I remember watching a midwife delivering babies, and I was there because I'm going to look after the mother who delivered the baby because of the pelvic floor exercises or post cesarean section for mothers who have been on anesthetics. I've done continence and I've done pediatrics, including neonates. So as I've said to Gareth the other day, is there was a day in my career where I have to switch from a newborn baby, looking after a newborn baby, all the way to seeing a 103-year-old elderly patient. And that is just part of the variety of what you can do in physiotherapy. Obviously, throughout the years while you are studying, you will get the opportunity to know most of the expectations in terms of the clinical background, in terms of the academic side of it. But when you finish university, and this is where you're going to start looking, or where do you really wanted to specialize? And physiotherapy, we're quite lucky because we've got a lot of choices. And some physiotherapists will do the core rotation, which is probably after 4 or 5 rotations, they have decided that they want to specialize in a certain area. Like in my case, I initially specialized in respiratory, and then over the time I started thinking that I really wanted to do cardiology as well, so I did specialize in cardiology. And then I touched base about cystic fibrosis, because there was a good program in the hospital where I can work with specialist MDT from London to do cystic fibrosis. So I looked after as well pediatric cases on top of what I am doing, which is at that time was cardiology. And then over the years, your life change, and the demand, personal and career do change, and you kind of find your way, where I said, probably I wanted to start looking at care of the elderly or geriatrics, because at that time I was interested in one of the conferences from a physiotherapy annual conference. They were talking about the future and how the population looks like by 2030. And that's actually made me decide, oh, maybe geriatrics is the future. And then, so I started getting involved in buildings, developing services for older people. And here I am now. So at Princess Alexandra, particularly, I got involved in um, shaping the service for older people living with frailty, and that includes patients living with long-term conditions, patients living with dementia. We had lots of patients with oncology problems as well, but it's just the complexity of the subject matter. But at the same time, it's not just the clinical side of it, but as a physiotherapist, I feel that I have been molded very differently, that I am a task-oriented professional, and I will always look for what needed to be done and how it will be done, rather than finding a way of why can't be done. So I think as a physiotherapist, we were trained to be positive thinkers. We were trained to find the solution rather than what is the problem, but it's always what is the solution. And I think that's what makes physiotherapy as a profession is very different. And that kind of attitude that you will build throughout your training, and even after your training in your clinical experience, was actually something that you would also use in your own life, in terms of being resilient, in terms of being resourceful, in terms of being, as I've said earlier, task oriented. But there were so many things that we use a lot of common sense sometimes. We always call ourselves in the clinical floor as we know everything, but we are not really a master of anything. But you can throw a physiotherapist anywhere in the hospital, and we know that we will survive. We have been thrown to a area where we have to open a new unit because there was a surge in pandemic. We just were expected to deliver. And I think as an organization, they rely on the attributes of physiotherapists and even the AHP. Oh, by the way, today is the AHP day. So it's Allied Health Professionals Day, which is physiotherapy is part of that profession. So and I think that is something that we could be very proud of. But in terms of the journey, so the journey you actually, I think what is unique about physiotherapy is you can make your own journey. It's not something a standard that this is the career progression and everybody follows the same process or the same structure. It's not like that. So I mean, everybody, I mean, people, I mean, post-university, there will be students who would like to go straight to going to have a hospital experience. But there are some physiotherapy graduates who will go straight to sports. And you will see them in the field when you're watching football, when you're watching tennis, and when you're watching whatever sport it is. There will always be physiotherapists working in there. You will see some physiotherapists going straight to research because they know already that that is what they wanted to do. And I have seen physiotherapists, and I have one now who is a doctor. So I have two physiotherapists that I have mentored in the past that who are now a medical doctor. And one is already a registrar. And I'm very proud to see him again because he's working with us again nowadays. And so there is, I'm saying is, getting into physiotherapy is not, it's not, being a physio is not the end, it's not the end of the journey. There is much more beyond physiotherapy. It depends on where you want it to be. And in terms of those who wanted to go in the line of management, so there are physiotherapists who are directors and managing multi professional team. Like I remember I've met a month ago a physiotherapist who is a director for patient quality and improvement. So that would mean it is a traditionally the nurses are doing those roles. But in his case, he was actually getting an extended practice. So those are the different opportunities that you can do as a physiotherapist.
Sure. Okay, thank you. That was you answered lots of my questions there, Janice. Thank you very much. And clearly, both you and Peter are very strong advocates of physiotherapy as a career. So, I'm not going to ask you the next question, which was going to be what are the most enjoyable aspects. I think you probably already covered that. But what I do want to ask you, because we do want to make sure we give the warts and all story here. And of course, lots of people will be considering physiotherapy, but it may not be the right one for them. So, Peter, what are the things that people perhaps aren't aware of, particularly 15, 16, 17-year-olds at school? They might be basing the career choice on wanting to be England's physio at the next World Cup. What are the things that people don't think about, or what are the challenges within the role?
Yeah. Okay, so there are a few I can think of. The first is that irrespective of where you want to go in your career, and that does change throughout your career in terms of your endpoint, if you like, where you think you might end up. For example, if you want to be England physio for whatever team it is, football, rugby, whoever, you've still got to train and you've still got to go through all of the intensive training that we provide for all of those specialist areas. You can't just say, right, I want to be a sports physio and that's what I'm interested in. You do have to learn about the cardiorespiratory, the neurology, the elderly care, and you have to experience those things on your placement. You can't cherry pick all sports placements or all musculoskeletal. So you do have to kind of do the nuts and bolts of every specialist area that we kind of cover and prove that you are competent in those areas as well, because you're not just qualifying as a sports physiotherapist, you're qualifying as a physiotherapist that can cover, as Janice said, anything that's thrown at them. And many of my colleagues that do work in the private sector or in the musculoskeletal area or sports injuries actually come back and say that their kind of ground work, if you like, their broad base of experience really helps them in those fields, because you don't just see a sports injury in isolation. It comes with some mental health impacts. It's not just a ligament that's torn, it could be a nerve that's affected as well, and the patient may have long-term kind of pins and needles or loss of sensation or an associated effect further up the kind of spinal column, if you like. So all those little bits and pieces and those different areas that you think, I'm never going to use that, you will in your career, and you do have to kind of go through that process of learning all those bits and experiencing it. I think probably part and parcel of that is understanding the reality of working in a hospital environment, working in areas perhaps where you wouldn't anticipate working, and kind of facing some of those challenges. And I'm sure Janice will back me up, working on the ward sometimes can be challenging, not just in terms of the time pressures, the workload pressures, but also the sights, the sounds, the smells, and the kind of things you have to deal with. For example, bodily fluids. We wouldn't anticipate someone running on as physio on the sports pitch having to kind of take some old person to the toilet and help them change their underwear, for example. But again, that's part and parcel of what we have to do in our training to get to that point that you want to be at. So I think that's quite a surprise to some of my students, even after my kind of talks to them to get them on the program on their first clinical placement. They're saying, I had to deal with this and that, and I saw that tomorrow, and this was really bad smelling and made me felt sick. And That does happen, unfortunately. It's part of the kind of realities of working in the real world. As Janice alluded to, though, if that's not your kind of preferred option, as you get more experience, you can decide then to go to a different part of physiotherapy and work. But you do have to undertake all those bits and pieces to start with. And I guess the other thing a lot of people don't perhaps think about in terms of physiotherapy is that we are on call. We have to work through the night sometimes, particularly when you're working. And again, it's not just those people that are working in cardiorespiratory, but you have to take your turn to be on call to come in and treat sometimes the sickest patients in the hospital. Those patients that are struggling to breathe are on the verge of not surviving. You have to come in at night sometimes when you're called in by the doctors or the medics to help them clear their lungs. So that could be maybe 2, 3 o'clock in the morning, depending on where you work. It could be multiple times throughout the night. So even if you're not a specialist in that area, you have to come in and kind of be involved in that on-call rota. And very often the hours we work are unsocial as well, those on-call times, but also we have to work at weekends as well. And many hospital units are now moving to a 7-day working and kind of an extended day working. So they have kind of morning shifts, kind of afternoon, evening shifts, and the twilight and night shifts as well. So the kind of role of physiotherapy is expanding, and our kind of the demands upon us are also expanding, I guess. So that's kind of things that I highlight, but I don't want to put people off. That's a small kind of fly in the ointment in my perspective. I'm sure Janice will probably be able to tell you a bit more about the realities of working in an acute hospital setting and some of the downsides as well.
Yeah, well, Janice, I mean, the same question to you. Once you've answered this question, it's all going to be plain sailing, and we'll talk about all the fantastic aspects of it. But look, it is a really important point, and for those of you that are watching this, particularly those of you that are watching this live at the moment and are giving up your time at home to watch this, it's really important that you have that full 360-degree aspect of what this career looks like, so you don't put yourself in for something that maybe you find out later down the line isn't for you. But Janice, anything that you think that a school student at the moment should know about the career before they really invest all their time and energy into pursuing it?
Yeah, I think it is very important to be prepared. It's mentally prepared, physically prepared, because it's not something that you go in, because from the first year you have to invest a lot of effort to it. And it's something that, because of the demand, I mean, I'm going to talk about, because Peter will talk about the academic side demand of it. But in terms of the demand, when you already graduated, as Peter alluded, is you could be on call. I remember during my early time is I could be on call from a Friday night all the way to a Sunday night, and you are expected to work on a Monday morning. And you could be, when it is your lucky night, you could be contacted and called in to come and see a poorly patient 3 or 4 times in a row in that night. So sometimes you just have to decide that you'd rather stay in the hospital. In one of the wards, you can choose which ward you wanted to stay and wait, rather than going home, because the next morning you are working again. But it's something that everybody, like young people, needs to understand. But obviously over the years, it's not just always about difficulty, and there's always much fun doing physiotherapy. And I remember there were activities that we have to do, like for example promoting general health and well-being, doing a research or an audit on how do we improve patient safety in relevance to falls or decreasing falls. You get to visit other hospitals, how they are doing, and benchmark in terms of certain quality improvement initiative you have in your department. So it's not always about seeing patients all the time. Majority of the work, so as a newly qualified physio, majority of your work will be seeing patients. But I think the good thing about us, as how do we look after our profession, is we embed right at the beginning that yes, we have to see patients, but at the same time we have to balance between our clinical and our non-clinical development. So when I say non-clinical development, is our leadership, organizations, our mentoring other colleagues, or even and the students, because that's how we invest for the profession. So we look after the future, not just the now. So we are talking about here because this is part of our future, the future of the physiotherapy. And you can see a lot of engagement from physiotherapists ourselves in terms of looking after the future of our profession. So we always look at succession. And that's the reason, like, with when you are on the clinical floor, when you decide to work in the hospital or in the community or in sports or in research or in an outpatient clinic, there were some clinics run by physiotherapy clinics in the local gym area or the private sector. We always have a succession in terms of how do we train. The training postgraduate is always holistic. It's not just you seeing patients all the time. So you will be given a protected time to actually develop yourself as a professional and develop your well-being at the same time, and at the same time develop others. And that is always the backbone of any physiotherapy department that I have worked with and I have shadowed throughout my career. And I think, I mean, we were trying to tell you the reality. The reality is it's not easy because, I mean, a lot of you are very much aware of the profession, the nursing profession. So obviously in their case, they have a rota system all the time. So they work early, late, and night. They work weekends. So over the years, physiotherapy has started to adapt into that kind of model because we have to. The world is changing. There's not a lot of doctors nowadays, not a lot of nurses nowadays, and you can see the AHP and particularly physios are stepping up really fast in terms of changing the way we work and changing the way we practice. And there are also like extended practices. So now you will see extended advanced physiotherapists or advanced clinical practitioners, which are physiotherapists. So that would mean they're able to prescribe. It's not just pharmacists or doctors who can prescribe. Even physiotherapists, when we study further after graduation, we could actually prescribe. You will see physiotherapists who are doing intervention or doing certain procedures, which is invasive procedures, after further studies post your 4 years or 3 years of education. So as I've said earlier, there was a lot of further education after you finish your physiotherapy degree. But all of these are done based on what and how you plan it. It's not something that this is just one journey. It's not. There were so many. I always explain it to my student that this is like the tube underground map. Yeah, it's like an underground map, and you have all sorts of different tunnels, and you can choose which color you like, and at the end you will succeed if how much you put into it. As long as you know which route you are going into right at the beginning, the opportunities are always there. And like in my case, I thought I wanted to do respiratory for the rest of my career, and right at the junction I wanted to do cardiology and geriatrics. I end up going into that direction. There are so many collateral journeys that you can do, even if you are right in the middle of your career. So it's not limited to just one thing. There are so many opportunities. Um, there were there was actually at the moment there were lots of physiotherapists doing research, and they were involved in clinical research. And I have one colleague who is now involved in the operational side of things. So following as a specialist. I think she was neuro. Yeah, she did neuro for a long time, and then she decided that after a few years of doing neurology, she wanted to make a better experience for patients and improve the system as a whole. So she diverted her career into management, and now she is creating pathways and creating services for for her locality. So and now she's not just managing physiotherapy, she was actually managing everybody: nurses, doctors, other pharmacists. I think it was under her not physio, she's got physiotherapists and occupational therapists as well. But it doesn't stop after graduation, as I've always been saying. And but it's just to be aware that the demand, it is demanding, it is demanding. There is no hiding that it is demanding. I think when I started my career as physiotherapist, the biggest demand for me is waking up at night in the midnight, being cold because the doctor cannot manage the secretion of the patient, and then you have to go to ICU and do what is necessary to help them and to help the patient. And as a young individual, for me, waking up at night 12 o'clock, 2 o'clock at night is not really appealing. And over the time, I just have to get used to it. But obviously, as a student, you won't get that practice. You will know that you will get cold at night when you started to be on the on-call rota. But I never thought it was that hard to get up in the middle of winter to travel, and you are expected to be in the hospital within 45 minutes because obviously it is a deteriorating patient. And but there are now different provisions. Like now in in our department, we are looking at an on-call room. So rather than you traveling in the middle of the night, we are actually offering accommodation, free accommodation for physiotherapists who are on call at night, because it's getting more popular. I mean, nowadays being on call is just like working in an ordinary shift. I mean, we don't even talk about it now. I mean, during my time, 17 years ago, when I was started doing on call, being an on call is a big deal. There are sometimes you just don't want to be on call because you're going to be working the next day. But nowadays it's just now a routine. I mean, everybody's expecting to be on it, and a lot of newly grad physiotherapists are actually very keen to get into the rota because it looks really cool. Because especially when you're doing respiratory and you're here, you come, you're like the savior of the night. And I think we are very much now accepted by our medical colleagues, by our the doctors, the difference that we can make in terms of working together.
Okay, thank you, Jo. You managed to turn what was sounded like it was going to be a negative question. You managed to turn that into a positive. So well done for doing that. I want to move on to the next session. I suspect this is where a lot of the questions and interest is going to come from based on what we had on registration. By the way, some of you have already started submitting your questions live. We will get through and we will make sure that we answer all of those for you. So if you do have questions, please put them through. So look, I'm going to hand this one straight over to you, Peter. To become a physiotherapist, first of all, I suppose easy question, do you have to have a degree in physiotherapy? And secondly, can you just start talking to people around the sort of choices they might make around why might they choose one degree course over another?
Sure, yeah. Certainly you do now need a degree in physiotherapy to practice as a physiotherapist in the UK. The term physiotherapist is a protected title by law. You have to have certain requirements in order to call yourself a physiotherapist and practice as a physiotherapist. The main one of those is you need a suitable qualification, and that is now deemed to be a degree in physiotherapy. In order to practice in the UK, again, you need to be registered with the Healthcare Professions Council, which is the kind of regulatory body that protects the public and makes sure we're fit to do our job. And again, you will only be able to register with them if you have a degree in physiotherapy. So certainly a degree is essential. I mean, when some of us trained, I think I was probably one of the first in my year group to get a degree. It was a diploma, but that's now changed to a degree. And most of the physiotherapy degrees in the country are honours degrees. So you have to include some form of research in that degree study, which is organised and provided by the universities for you. And you come out with an honours degree. So you've done an element of research in your studies, which again, as Janice said, is really helpful if that's where you want to go. But if not, you still need that kind of understanding of research and the evidence base and evidence-based practice to inform what we do with our patients wherever you work as a physiotherapist. In terms of the choice of universities, yeah, there's lots of choice, and to be honest, and over the last 5-10 years, we've seen a really big increase in the amount of different higher educational institutes or universities providing physiotherapy degrees. So there's lots of choice out there on the market now. And it really depends on kind of things like where you live, which university you think you might want to go to, which is the kind of the most accessible for you. And again, it's looking perhaps beyond the university, but looking at the quality of the physiotherapy degree program. Lots of people understandably look at things like league tables often that misses the kind of nuances and the quality of the education you'll be getting in the physio program. You may all find universities very highly rated on various league tables, but that's often a look across many different subjects. So you need to drill down and find out about the individual physiotherapy degree program and what that provides for you. And again, we all teach things in very slightly different ways. You come out with the end same product. You all are qualified as a physiotherapist with a degree and an honours degree, but what that looks like in terms of your understanding and your knowledge base can be quite different depending on where you've trained. So again, it's worth kind of doing a bit of research and finding out what's actually taught on each physiotherapy degree program you might be considering, and how is it taught. You know, some students, some universities teach in very different ways. For example, at the University of Hertfordshire, we use what we call a thematic integrated problem-solving approach, which is a little bit of a mouthful, so I might just explain that for a moment. Essentially, the integrated side of things is we look to try and follow those kind of core themes of physiotherapy, and I mentioned a few of those earlier. So there's a cardiorespiratory kind of theme, a musculoskeletal theme, a research theme, and neurology theme. And that goes on throughout our 3 years of study, but we build on that year on year. And we use kind of problem-based scenarios to teach our students. So we'll have a kind of a paper patient, which often reflects a real clinical scenario that we've seen or we've worked with or are currently seeing, because a lot of our lecturers are clinicians as well. So you'd work through this kind of problem-based kind of scenario where you solve the problems, you look at what research is needed, look at the evidence base, the practical skills, and we teach that all together. Whereas some other universities perhaps might well spend a lot of the first year teaching you about all of the anatomy, okay, and maybe looking at maybe some of the assessment skills. And then the second year is looking at some of the treatment skills. So for example, that's a logical way of working and makes sense, but it means actually when you go on placement, you can't really treat patients until the end of your second year because you haven't got those treatment skills already to hand. At the University of Hertfordshire, that integrated approach means we look at a subject area as a whole and teach you everything you kind of need to know about that. So we may well take, for example, someone with, I don't know, a knee problem. We teach you about the anatomy of the knee joint. We teach you about the biomechanics, how the knee works. We teach you about the diseases and the dysfunctions and the problems that can occur with the knee. We teach you how to assess someone's problems and problem solve what's going on there and put a plan in place in terms of how we treat them and manage them. And we teach you how to treat and manage those knee problems. We teach you about the ethics involved, because obviously there are ethical issues to consider every patient you treat, as well as the evidence and the research surrounding what we do. You know, is it actually valid? Is it relevant what we're doing? So at the end of that block of study, you're actually prepared to go out and treat patients with knee problems straight away. Obviously with supervision from people like Janice and her colleagues that look after you on placement, but you have those skills. And again, some of universities teach it in different ways. So it's just kind of looking at what works for you really in terms of how the program is delivered. And also perhaps a key thing to think about is how the placements are structured. We all have to do placements. It's a requirement, again, to qualify. You have to do 1,000 hours of clinical placement working in the clinical units, be that the hospital or the outpatient setting or someone's home, with a qualified physiotherapist such as Janice and her colleagues supervising you, and you need to pass that kind of competency. Now, some universities kind of keep their placements maybe in the second year or towards the third year, or spread them throughout the program. And again, it's kind of thinking what works for you best. What's the kind of learning you like to achieve? Again, at the University of Hertfordshire, we will have our placements in the first, second and third year. And we're one of the few universities that send our first year students out on placement really quite early on. So 12 weeks into your program, you start in September, in the January, you're going out on your first clinical placements. And again, it sounds a bit scary and a bit daunting, but actually it's a really good experience and lets you embed what you've learned. And at that point, you have the skills to actually treat patients. It's not just an observational placement that many other universities might have in their first year, where you stand and watch and nod and smile and try to learn from watching. You have the skills to treat patients and manage them, of course, under supervision of people like Janice. So I think in terms of universities, there's many choices. There's different routes into physiotherapy. You can have the full-time honours degree program that we run, for example. There are many kind of programs coming on stream across the country now, which are accelerated master's degrees. They're still pre-registration. So if you've got a current degree that's maybe in sports or healthcare or something science-based, we can use that as part of your learning already. And often you can enroll on an accelerated master's program where you do 2 years instead of the usual 3. It's quite intense, but it's quite a good way of getting there. And again, it's a different kind of way into the profession. You still come out with your degree. Admittedly, it's a master's degree rather than a BSc, but at that point, and only at that point, can you then call yourself a physio and start working. There are postgraduate master's degrees you can take. That's when you're working as a physiotherapist and part of that continual professional development that Janice mentioned. There are apprenticeships also happening across the country. There's not many of them at the moment, but there are a few springing up. Unfortunately, at the University of Hertfordshire, we don't run that because there's not the demand, there's not the groundswell of people wanting to do apprenticeships. And to do an apprenticeship in physiotherapy, you have to be working in that field. And often it's assistants, physiotherapy assistants or technicians that then go on to advance their skills by doing an apprenticeship at the same time they're working in clinical practice. So again, that might be an option if you're working in the physiotherapy or healthcare field currently, that you can kind of do that alongside your working week as well. Again, different kind of routes to suit different people, I guess, is the thing. So it's worth doing your research, having a little look at the programs, going to some open days, talking to people like myself, the admissions tutors, talking to students and clinicians, and find out what kind of program might suit your needs. Does that kind of help?
Okay, so yeah, well, I think on one hand, you're saying that there's a fantastic array of choices for anyone who wants to do physiotherapy as a degree. Lots of universities offer it, but the devil's in the detail. So you've really got to make sure that you read those course descriptions and you can compare them. I'm going to ask this question to you, Peter, because I think it's more relevant for you, and then I'm going to get Janice's views on something slightly different. So the prequel question to that is, what subject should someone do at A-level that are going to be good for physiotherapy? So that's a question that we've had come in here from Izzy. What subjects at A-level are good to have for physiotherapy, and which courses would be good to take? So, I mean, do all universities, were they all going to be looking for the same A-level or equivalent choices?
It's different for different universities. Again, it's a bit confusing, unfortunately. Different universities have ever so slightly different requirements in terms of what they accept. Now, broadly speaking, most of the physiotherapy programs will be looking for some level of education, level 3 or above, which is equivalent to A-level or BTEC or Access course in science, because it's very much a science-based profession. We are based in science, and we are kind of, what we do is dictated by the evidence and the research. You need to have those scientific principles. So often we're looking for A-levels or Accesses or BTECs or level 3 qualifications in science. Now, some universities will dictate that has to be in biology. Some are a bit more kind of open in terms of what they'll accept. So for the University of Hertfordshire, again, sorry to keep talking about that, but that's where I'm from, we would look at any science, so chemistry, physics, biology, even we include maths in that because it's got kind of scientific principles. Obviously, biology is a real advantage, particularly the human side biology, because that gives you a bit of a leg up in terms of knowledge and understanding, but we need those scientific principles. The other science that perhaps we would also consider, and certainly at UH we do, is we would take PE, A-level, as a science as well, because actually in PE there's lots of understanding of human movement and human anatomy. So that's the kind of thing that we might look at in terms of A-levels. Most universities will require at least 3 A-levels or the equivalent of 3 A-levels, and it's quite demanding to get in. It's quite a competitive market, I'm afraid, even though there's lots of choice. And again, most universities will be looking at you to get the equivalent of somewhere between a BBB right up to A, even triple star A sometimes. So there's a big range in terms of what universities will accept, but it is demanding. You'll be looking for at least Bs and above, I'd imagine, in your A-levels, or the equivalent in an access diploma in science, perhaps, or BTECs in science or sports science, the equivalent kind of levels. So I think definitely sciences are good. At the University of Hertfordshire, we require 2 sciences, and that could be physics and PE, or it could be kind of sociology and chemistry, or biology and chemistry, and A another. The A another doesn't really matter too much. We just need to know that you're able to study that level and that kind of breadth of information for the length of the kind of program. So you need to be able to study kind of 3 A-levels or equivalent at the same time, essentially.
Yeah.
Don't be fooled by just the level 3 qualifications as well. Whilst that is extremely important, most universities also will have requirements at level 2, so GCSE level as well. So usually we would expect students to have, you know, A to C GCSEs across the board, and almost definitely A to C or above in English language, science, and a maths usually. But again, those requirements vary from university to university. So again, as Gareth said, the devil's in the detail. Work out which university you kind of like, which program you like, then look at the individual kind of requirements. So it's worth doing your research now before you start doing all your studies, or certainly getting some advice on that.
Yeah, okay. And it is just in a follow-up question to that, saying, so A-level BTEC in sports science, A-level biology and psychology would be acceptable. I mean, it sounds like that's probably a good combination.
Yeah, that's a good combination. To me, I would accept that certainly from University of Hertfordshire. Again, you'd need to check because some universities don't put the same kind of emphasis on BTECs as they do A-levels, I'm afraid, even though they're supposed to be equivalent rather. Some universities favour one type of qualification over the other. So again, it's about kind of looking at which universities are inclusive and open to widening participation and look beyond the very dogmatic human biology, science, and another subject is what else might they take. And again, in physiotherapy, it's not just about the qualifications. We're also looking at the skills you bring as well. Qualifications are great, but you don't need, again, between us here, you don't need to be Einstein to be a physiotherapist. Certainly I wasn't when I did my A-levels. I wasn't very good academically, but it's about the skills you bring as well. So again, are the universities you're looking at, are they prepared to look beyond just qualifications and see your skill set as well?
Yeah, okay. And in fact, you raised a really good point there. I'm interested to get Janice's views on this. So regardless of someone's qualifications, Janice, and clearly they are important if you're going to become a physiotherapist or anything within medicine, but what are the sorts of skills and qualities that you would say as being really important for someone who's going to become a physio?
I think it's being committed, and it takes a lot of commitment to actually enjoy it, because it is not an easy profession. It is not something that you walk in and then you see the patient, because the patient relies on you, and the patient will be looking up to you to be able to regain that quality of life. As probably a lot of you on here have got some kind of an encounter of how physiotherapists once or with their family members. It's a lot of, as physiotherapists, we try and bring the quality in the lives of all our patients, and that is the advocacy of the profession. So it's a lot of, as Peter was saying, is it's a lot of transferable skills. It's a lot of when I say being compassionate, being caring, is that you like to work with people. I mean, I always say for new, like first year student, I always break them in gently to the clinical floor by getting the history and trying to get a conversation with other people or patients who have been unwell for a long time. And sometimes you really dwell on the experience in life that you have. You could be doing a certain job in the past that you get some transferable skills of customer care, because you know how to start a conversation, you know how to get the right information, or sometimes you just know how to start from somewhere. It was very hard. I mean, I remember when I was a newly grad physio, I can never start a conversation, but it's something that I had to work on in terms of, as a young professional, how do I get to start a conversation with somebody who has been very knowledgeable and experienced in life. And you have to have a certain degree of maturity, and throughout your training you would learn to get this, but you have to practice a lot, and it's more of maturity on what goes on in the world, because you are trying to encourage someone to do a certain exercise or to do a certain program, but if you yourself doesn't believe in it, then it doesn't come across in the right way. And the patients do know when you're actually just bluffing, because the the relationship between a physiotherapy and the patient is very intimate. It's in a way that you have to know a lot about the patient, and how they learn, how it's like a teacher, how they learn the subject, how would they perform, how would you use your psychological skills in terms of making them to do the things that you wanted them to do for their own good. And it takes a lot of patience. And at some point, I remember when I was doing musculoskeletal, there were some patients who doesn't like to do their exercises, but they love to come. They're there every week on time, but they just don't do their exercises. And where do you draw the line? how do you become more authoritative, so they actually understand and they actually engage to what you were saying. So there are a lot of skills in life that you really need to do physiotherapy. And like, for example, when I was interviewing for the intake for university, we always have an activity to know the different skills, qualities, and attributes of the candidates, of the students who are applying for the degree, because obviously we have to make sure that you've got the qualities that we can, or potential that we can build over the years while you are studying. And at the same time, as a clinician, that I know as you build it in the university, you've got a good foundation, and when you go to the actual world, you actually able to survive the demand, because these are people who are unwell. I mean, obviously, when you go to sports and when you go to research, it's a different thing, but the demand physically and mentally is always there. I mean, being a critical thinker is actually a good attribute to have, because you will be analyzing people, whether we like it or not. We have to analyze why it's not working. Is it because the patient just doesn't want to do it? Is there other reasons why is it not working? I remember, I'll give you a good case. I have a patient who is alcoholic, and we have been trying and trying and trying to rehabilitate, to get him to stand up and walk again. Prior to his condition, he was independently managing. He was driving. He was a lorry driver and was managing all by himself. I know he was quite young. He was only 54. But at some point, while he was very unwell because of a liver problem, then he was not been taking on the advice from the doctors and from us, from the physiotherapy. And to the point we thought that we were just going to give up as physiotherapists. And I said, oh, we've done everything, all the exercises, all the strategies, all the psychological things that we have to do, and everything we've done. Until to such point that one of our students actually told us, it says a second year student actually said, do you think he is depressed? Is actually, that was the turning point. The doctor started on antidepressant, and 2 weeks down the line, he started standing up and walking. He walked out with a stick.
Mhm.
He's been in the hospital for 3 months. We having doing physio, and he's been acutely unwell on and off, so we can't get him to a rehabilitation center. So he's always been in the acute hospital. But I think it's the longest time that he's been in the hospital. For 3 months, he became institutionalized. He got depressed. But because we were so bombarded that, we've tried everything, we changed, we've got all sorts of different equipment modalities to get him engaged, never worked. But it was a
Yeah.
student, and I remember that student, and he said, do you think, he was just like a casual conversation, do you think he is depressed? And then I said, oh, that's actually a good point. We did the depression scale, and he definitely triggered, started
Yeah.
on antidepressant, 2 weeks on. After 2 weeks, standing up, getting up, and then on the third week, it was walking to the toilet that was about 20 meters from his bedroom. And I was like thinking, why we never thought about it? And but it's to show you the collaboration. You need to be open to collaborate with others. You need to be open to receive other people's opinion. You need to be open to accept that you are not always right, because physiotherapists are autonomous practitioners. When we say to the nurses or to the doctors, I am not happy to discharge the patient to the community because of so and so, they have to listen, because we are an autonomous practitioner. When you graduate, you're an autonomous practitioner. That means you have the same spot, the same as the doctor in the clinical floor. But sometimes you have to listen from each other, and you have to understand that, different professions has got different way of thinking, or even a student, or it could be a domestic who's cleaning there, who knows the patient, probably come up with something else. But you have to be open and honest as well, that, when you don't know, then you have to ask and consider other people's opinion. But that is the beauty of being an autonomous practitioner, because you know your boundaries, and you would learn throughout the years, from university all the way to clinical practice. You'd learn throughout the years that we yes, we are autonomous, we have a say, but at the same time, it is our responsibility to actually to listen to the other professional advice, but pick on what needed to be picked, and then work the way around it for the benefit of the patient. But at the end of the
Sure.
day, you will always be an advocate. You have to be prepared to be the advocate of your patient, because sometimes, like in your neurology and in IC and in critical care, a lot of your patients in critical care, obviously, a lot of your patients are not even awake. So you have to advocate for them. There were decisions that will be made in front of you. And sometimes when you know and you have heard the history from the family, you may be the first one there to say, oh, by the way, I don't think this is what he wanted. So you have to be prepared to advocate for your patient, sometimes advocate for the family, because you were there. Because I think with with physiotherapy is, you know, quite a lot of history, because we build the program, we build the exercise program or the rehab or the treatment program based on as a whole. So say for example, a patient comes in with a broken knee. We're not just talking about the broken knee. We're also talking of the whole self. We also talk of we also will be planning of how that broken knee affects the person's not just the mobility, but how does it affect the household of that patient who's going into. So we're quite nosy, really. We look at, because for example, a good example is an elderly patient. You know, a patient will come into my unit having a broken finger. As a physiotherapy, I just don't fix the broken finger, because I can just put a splint there and that's done. It's not like that. A physiotherapist will look at how do they manage, how do they get themselves dressed, how do they get out of the bed. Is there somebody dependent onto that patient? So we will be thinking about what happened to your husband or to your wife, or if it is a young parent, what happened, who's looking after your children. We also think about what happening to your work. Are you able to work? Are there any adjustments that needed to be done? So all those things we look after. So it's kind of like mothering and fathering the patients, but you are looking them
Sure.
as a whole, not just a broken finger. And I
Yeah.
think that's the quality that, you know, a physiotherapist would make it unique compared to other profession.
Sure. Okay. That's an incredible detail there in sharing your own experiences. And I'm sure everyone that's watching this at the moment will be picking up some really, really invaluable information there about the sorts of skills and qualities that are needed. I'm conscious that we just ticked over an hour here, so I'm going to wrap up, because I know everyone's got other things to be pressing on within their evenings. But just a couple of questions that I want to try and answer before we close. This is a really good one, Peter. What extracurricular things should I do in sixth form that will help me get into university and study a medicine-related course? So it's just not the numbers that someone's got on a predicted grade. What else could they do?
So looking to try and make yourself stand out from the crowd a little bit and demonstrate those kind of values and attributes that Janice has talked about. So can you get involved in some kind of committee? Can you show us that you're involved in communication in a wider team? Can you do something over and above your usual studies? Can you kind of, perhaps you can work as a group representative for your class and represent your views? Can you go out and do some volunteering experience? Can you volunteer, I don't know, local church or a soup kitchen, or can you volunteer and take food to COVID patients, or people that are isolated at home? It's just doing that a little bit extra and trying to show us you've got those communication skills, those teamwork skills, and that kind of showing the empathy, the compassion, and the wanting to care for people that can really help. So any of those little extra bits, being a sports captain, working as being a football team captain for your local team, and talking about teamwork and leadership in your personal statement can really make you stand out a little bit as well.
Sure. Okay. And then is sports massage a big aspect of physiotherapy, or is that a completely separate?
It's about that much as physiotherapy. It's a little tiny bit. Again,
Yeah.
we do massage. We do massage patients for therapeutic reasons, not just to make them feel nice and better. And that's often what our patients think we're going to do. I'll go and see the physio. They'll rub my back. It will feel nice. I'll go to sleep and it will be better. Actually, no, our type of massage is often quite different from a masseur might give you. It's often not that relaxing sometimes, because we're looking to try and increase blood flow and release scarring and those kind of things. But yes, we do massage for certain conditions, and we do obviously do sports massage as well. And I think our students at the University of Hertfordshire often arrange their own external sports massage course to give them some extra transferable skills that they can use in other areas. So, for example, some of them might go and do some pitchside first aid for a local team, and they might use their massage skills there as a masseur, but not as a physio student. So we do it. It's just a little bit of what we do, I guess.
It's okay. This question: are EPQs helpful to get into uni?
Okay, so EPQs are extended project qualifications for those that are not familiar. Yes, they can be. They are on UCAS, which is kind of the clearing system for universities. They give them kind of points, if you like, and all qualifications have points, and they're kind of equivalent of half an A level, essentially, in terms of the UCAS points. Some universities will look at that and think, yes, I'll take that in lieu of something else, or I'll use that on top of what they've got to make me decide to make them an offer, as opposed to someone that hasn't got an EPQ. So yes, they can be relevant, but again, devil's in detail. Look at the university. Do they take EPQs as one of their qualifications, or like University of Hertfordshire, is it an extra add-on that might make me choose you over someone else with the same qualifications? So yes, they can be helpful, but again, check with the universities you're applying to.
Sure, okay. And then you might know the answer to this one. If you don't, I've got the answer. Well, I've got an answer for it. What is the average salary for a physiotherapist?
Janice, any idea for a newly qualified? I don't know.
I think a newly qualified is around 27,000. But I'm not very sure because it depends on where you're going into. So if it is the NHS, so you can Google it, and it's called the pay scale. So you're looking at a band 5 level, which is the entry point. So you can Google it and find out. But obviously, if you're working privately, so it has got different salary ranges.
And also, whether you're working in London or out of London as well, you get this thing called inner London rating.
In
London.
Of course, yeah. Fine. So, John, just to close with a couple of websites that people may want to go and have a look at off the back of this webinar. So the Physiotherapist, I can't actually read that. The Chartered Society of Physiotherapy, I guess, is the body that all of you are members of, and probably a good place to have a look.
It's a great place to have a look. You don't have to be a member of it, but it is recommended. It's kind of our professional body that also provides insurance for us as clinicians. And yes, they have lots of information about the career and how to get into it.
Sure. And then, Janice, I'm sure you'll be a big advocate of the Step Into the NHS website, which is a fantastic website that contains a whole host of information about physiotherapy and different careers within that. The other site that I would like to make sure that you're all familiar with is our own HOP site. So that's the Hertfordshire Opportunities portal, which I am going to remind you of through here. Those are all of our social media handles as well. This is a one-stop shop for any students or young people in Hertfordshire, where you can find out about a host of information about careers within the county. But within HOP, there is a careers directory service on there, which you can click onto, and that will bring up details of any particular occupation, including physiotherapy here. So it states here, you can see the average salary for a physiotherapist in England is just over 31,000. So it's not the starting salary, that's the average salary. But of course, as Peter and Janice alluded to, there's quite a few variables that go along with that. Okay, so I think we're going to wrap up here. I think we've answered all the questions that have come in. So thank you so much for those of you, particularly those of you watching live, giving up your evenings. I hope you found this really informative and I guess quite inspirational as well, hearing from Janice and Peter. But most of all, let me thank Peter and Janice for giving up their time for us this afternoon and sharing their experiences with us. So thanks ever so much for all your incredible insights here as well. This video will be made available on our HOP website probably from tomorrow morning. We've got another 35 videos that we've made over the last 18 months or so with different careers. We've actually covered physiotherapy. It was one of the very first ones that we did with a sports, well, someone who specialised in sports physiotherapy. So if that's a particular area for you, you might then want to go and watch that one as well. So thanks for your time today. Very, very best of luck with your future studies and career choices. And hopefully within our audience at the moment, there'll be a few physiotherapists coming through into the system in Hertfordshire in a few years' time. So all the very best and thank you.
Thank you. Bye-bye.